Herpes virus is RNA. Let's forget about the DNA. Let's talk about this RNA, which has been presented by Dr. Wagner. It's immediate and early and late transcriptioning. How it happens and how it affects. And I want you to please keep in mind this is happening in the nucleus of the neuron. The alpha messenger RNAs leave the genome, go to the cytoplasm and transcribe and come back as the alpha protein and attach itself with the viral genome again. Then the beta messenger RNAs, they detach themselves, go into the cytoplasm and transcribe as a beta protein. No sooner it does that, the DNA replication is taking place again in high stress, high heat, and internal injury. Well, in the Middle East, a lot of our youngsters, they go to work and come back with a hypertension. Well, gee, what happened? A lot of sciatica pain. Well, gee, what happened? Well, is there a possibility? Well, what percent of, in Pakistan, what percent of patients they really have one time or the other the contracture or the exposure to the herpes? I think that our social structures are such liberalized that I'm drinking the water, somebody is thirsty, oh, you can have it too. Yeah, if there's a herpes simplex 1 sore on the mouth, you got it. It's the time that you're waiting for when your immunity is going to compromise, and then it's going to do the same thing under 3 conditions. What are those conditions? The middle age, when the immunity is not able to support you 100%, and the high stress, and the high heat, and internal injury. This is going to take place. The encapsulation, take place or not, DNA forms or not, that is no concern of mine. My concern is, if this anomaly took place, it is going to compromise the homeostasis of that new controlling neuron. And if that controlling neuron happened to be in the cardiac center, the respiratory center, the liver center, the gastric center, or the colon. Surprisingly, yesterday one of my patients came in and I'm treating her hypertension with these infusions. And she said, Dr. Saab, I forgot to tell you, I used to have, she said in Urdu, मुझे खुश्क बवासीर थी, तो मैं बैठ नहीं सकती थी, तो मुझे क्रीम लगाना पड़ती थी. जब से आपने ये 6-7 इन्फ्यूजन लगाई हैं, I'm healed. I no longer have that pain. That activity, that pathology we cannot ignore in today's clinical outpatient flow. As I think that I can stand here and say that. All the patients seen here right now, this minute here in this very hospital, I would say a good percentage of the people, they are inflicted with the same cytopathology. If we see that cytopathology, that automatically become a primary diagnosis, because this is the primary disease. Everything else is the secondary. Because the control center is hijacked. Then what do? This is the last of the animation that I'm going to show you. Then we'll go on to talk about the hypertension. The virus is contracted, lands into the trigeminal ganglia, and that process, the previous slide that we have seen, that take place, the many chromosomes associated with the cellular histones, they help the multiplication of the nucleus's DNA inflicted with the herpes infrastructure. Now, if the stress is caused, internal injury or heat or immunity compromises, we have a chickenpox attack all over again. Not only that, but look at from the dendrites. It is also able to communicate from one dendrite to the other and into another cell and its nucleus. Ladies and gentlemen, it takes anywhere between 2 months to 20 years. Once we cross our middle age, when I first went to the United States 35 years ago, our average life expectancy was 60 years. And we could say that 30 years is the middle age. And today I see it is 46 years. So we are 23, 24-year-old talking about the chronic fatigue syndrome, talking about the esophagitis, gastritis, talk about the hypertension, talk about a lot of psychiatric problems, depression, and on and on. But we need to really stop and think, is there pathology behind it? I would say 9 out of 10 people, they have this pathology. This is just the write-up of what we have seen. The alpha messenger RNAs detached from the viral genome, transcribed to alpha protein. Beta RNAs into beta protein. This gives rise to the viral DNA replication and structure RNAs. When I presented in 2006 my paper on the hyperlipidemia world record, the 82% reduction, Dr. Yahya, the cardiac surgeon in Lahore, he was the chairman of the session, and he asked me that, how does this happen? This virus is anaerobic and amino acid. It will not take the energy from just the glucose. It has to take the energy from lipoprotein. Once we link that, well, if that's the hypothesis, that's right, then we should give the antiviral therapy to the patient and see the results. Lo and behold, 82% reduction of the hyperlipidemia in 10 days. Why? Because we deterred this process. I will not say that we evacuated this process. We cannot claim that. It comes back again every summer. The high heat, it does it again. The difference between the herpes virus and the HIV, human immunodeficiency virus, is the HIV virus continues to change its shape into multiple morphology. The herpes, on the other hand, it only changes to episomal stage, but the dangerous thing it is doing is continues its RNAs important, continue to transcribe. And that's what is going to clear up the neuron, the nerve, what have you, and then cause the neurological symptoms as well as the secondary disease symptoms. There are a lot of folks that are working on it. Primarily known that it had, the envelope had the 8 glycoproteins, but actually the attachment, which is contact to both the envelope and capsid, contains 50 to 20 proteins. That's no concern of mine. My concern is if this pathology is taking place subnuclearly in the neuron, we need to look at the antibodies against it. If the antibodies are a little higher than the normal, then yes, that war is taking place. And before we are trying to fix the amenorrhea or infertility or hypertension or cholesterolemia or anything else, we need to look at it and we need to remedy it. And then we need to look at the problem. What is going on with the secondary disease? University of Virginia, NIH, Baylor University, and also the MRC Virology Unit in Glasgow. They're all working on it, just trying to understand the behavior of this virus. And I said that we have not only understood the behavior, we also find, we changed it and we played with it and we relieved some of our patients from these diseases. This is the make-believer for me. Dr. Alex Malkin, Marco Plante, and Alex McPherson from the UCI, University of California, Irvine, they actually took this atomic force microscopy